That's my cue. Hello, hello, hello. Good afternoon to some, good evening to others, depending on where you are um, across the globe. My name is Amina Woods, and welcome to our program. Welcome to Birthing the Magic Collaborative's webinar on breastfeeding and nutrition. And right time and right place because August is Breastfeeding Awareness Month. And so today's program is right on time as this week also recognizes Black Breastfeeding Awareness Week. And boy, are you all in a treat for today. We get a little insight and information and education worth more than gold, liquid gold, right? From a person whom I hear is a unicorn. We have Miss Dykibra Gaskin here today, all wrapped in one person. She is an international board certified lactation consultant and a registered dietitian. Right. So our program today, Fueling Your Breastfeeding Journey, essential nutrition for you and your baby. Dykibra is going to share some tips on how to help the mamas in your life, yourself if you're a mama, help you learn tips on how to keep your mamas nourished while also feeding the baby. So just a little bit about myself. My name is Amina Woods. I am a clinically trained social worker and perinatal doula. That's a fancy name for saying birth doula. I also have experience as practicing as a clinician, meaning I am trained to treat and assess mental health disorders. I do have a specialization in maternal mental health, which is what led me into my work as a doula. So I'm so excited to be able to help share this information with you all today, because this information is my love language. It's some of my favorite topics to talk about. And so let me just share a little bit about Miss Dykibra with you. Dykibra is, like I mentioned, where'd my screen go? She is an international board certified lactation consultant and registered dietitian. And she serves the Tallahassee and surrounding areas. You guys are lucky to have her out there. She's a graduate of Florida State University and she has over 16 years of experience as a dietitian and 10 years experience in lactation. She's been married for 17 years to her college sweetheart, and they are the parents of two beautiful daughters, ages 10 and 6. Dykibra earned a bachelor's in human sciences at Florida State with an emphasis on exercise physiology, and she continued her studies at FSU, earning a master's degree in food and nutrition with an emphasis on clinical nutrition. In her previous professional roles, Dykibra served as the director of the WIC and Nutrition Program in the Department of Health for 6 Tallahassee counties. She was an adjunct faculty member at Florida Agricultural and Mechanical University, better known as FAMU, and she taught nutrition courses to undergraduate students at FSU. Currently, Dykibra works at Tallahassee Memorial Healthcare as a clinical dietitian, specializing in pediatric and infant nutrition. She serves as a member of the Florida Breastfeeding Coalition Board of Directors, and she's a member of the Melanin Mothers Meet, which is a nonprofit group dedicated to supporting mothers and reducing Black maternal mortality rates in the Tallahassee area. In May of 2022, Dykibra launched her private practice, Compassionate Care, Nutrition, and Lactation Services. And on August 22nd, 2024, she received the Angel Award for her work in maternal and child health. Though trained as a dietitian, Dykibra's passion is public health and infant child feeding issues. In her work, human she focuses on human milk feeding and the promotion of healthy lifestyle from infancy through adulthood among minority underrepresented individuals and communities. As I mentioned earlier, the month of August offers us the opportunity to raise awareness on the importance of breastfeeding for Black and Brown mamas. And Dykibra's presence here today is right on time. This evening, she'll offer us valuable insight that you can share with any other new mamas that you know within your communities, your families, and beyond. And as Marie posted earlier online today, when you're informed, you're empowered to make a real difference. Welcome, Dykibra. The virtual floor is yours. Thank you for being here.
Thank you so much, Amina, for that wonderful introduction. And I am very grateful for this invitation. I definitely want to thank Marie for reaching out to me. I'm very excited about this. I hope everyone can hear me. All right, so I am going to get right into it. I'm going to share my screen if you just bear with me. Let's make sure we have it, and then we will start our presentation. Okay. Sometimes you can't always see. All right. So I really love the title that Marie had suggested. So we're talking about fueling your breastfeeding journey, essential nutrition for you and your baby. And we're going to focus on nourishing the mom because when you're breastfeeding, obviously nutrition is related to, you know, milk supply, your well-being, all of that in turn nourishes your baby. So today we're going to talk about the 4th trimester, the role nutrition specific key nutrients play during postpartum recovery, and we'll touch a little bit on the risk of PPD. We're going to talk about food and snack ideas, and then nutrition for those diagnosed with postpartum conditions such as gestational diabetes, preeclampsia, and hypertension. And then we'll talk a little bit about that 4th trimester support and resources. So what is the 4th trimester? We talk about the 4th trimester, and I really like this term. It means the first 12 weeks or the first 3 months after delivery. So Moms often have the least interaction with their care team during this time versus when you're pregnant, you have so many visits. They want you to meet monthly, then they want you to meet like every 2 weeks, and then they want you to meet every week. And that's important for some people do need close monitoring. That's not something everybody requires. But after you have your baby, all of that care and attention and worry kind of falls to the wayside. And it does leave a lot of new families kind of, struggling, like, where do we go? What do we do? And a lot of times it's just that one appointment, but the American College of Obstetrics and Gynecology are now recommending initial interaction with your OB or with your midwife within 3 weeks of having the baby, followed by ongoing care for at least 12 weeks. Now, one thing I like to share is because I do work with a lot of lower income families, and a lot of them are participating in Medicaid. What happens with what we call pregnancy Medicaid in Florida is you kind of lose it after 6 or 8 weeks, depending on how you delivered. So a lot of times they get seen once within 4 to 6 weeks, and then that's it. So a lot of this tends to be insurance driven, but I'm really, really glad that ACOG is coming out with these new recommendations, because as we know about everything that happens in the fourth trimester, we still need that close monitoring. We were worried about baby, but who's worried about mom? So why should you attend it? This is important because we want to make sure that if you have any chronic diseases that came up, or you have to do any medication, that's managed. So some people do develop hypertension or blood pressure or even kidney problems just by being pregnant. So we want to make sure that's getting followed up on. We want to make sure the uterus is going back down to normal size. We want to make sure postpartum bleeding is being managed. And that's a good time to assess postpartum depression or postpartum anxiety risk. We're looking at iron levels. We're talking about family planning. So many really, really important things go on. Some people do have tears or had a C-section. So we really need to have a professional, like, again, your midwife, to look at that stitch. Sometimes the doula is the first person to notice something. So that's why it's important to do that follow-up care with the professionals who have been working with you during your pregnancy. So I always bring this out. I know this was supposed to talk about nutrition, but this is just too important, and I would be remiss to leave it out, because we're talking about the fourth trimester, and I don't just focus on just the breastfeeding, just the baby. We're talking about the whole mother baby dyad. So it's important to know about any possible complications that can send you back to the hospital. So that's going to be fever and chills. There's some that lets you know that something is going on in the body. Heavy, brisk, bright bleeding can be postpartum hemorrhaging. Sometimes these things don't come up right during the delivery. Shortness of breath, headaches could be a sign of a blood clot, or the risk of a stroke. Or then deep sadness, preoccupying thoughts of harming yourself or your baby. These are going to be things that people in place should be able to identify, or things you should be able to identify with yourself. And understanding these things and telling your loved one to get back to the hospital immediately really can save a life. And so again, if the mother's not well, the baby is not well. So it's very important to know these possible complication and warning signs. And also, I would be remiss again, complications that are unaddressed can also contribute to poor nutrition. And that's what we're going to really focus on. If mom's not feeling well, or she's feeling sad, she's worried about the baby, one of the last things she's going to do is eat very well. One of the last things she's going to do is pick up her baby often to be able to breastfeed. And she's, more likely going to not meet her breastfeeding goals. So this is why all of this is so important. Okay, and then 1/3 of maternal deaths actually occur after the baby's born, somewhere between that first week and that first year after delivery. So let's think about this fourth trimester. There's so much going on. You now have a new member of the household. You go from a household of 2 to 3, or 3 to 4, or 4 to 5, whatever. You have a new person who you have to learn, who the other household members have to learn, and this person is getting to know you. You have to adjust to new sleep-wake patterns. I remember when I had my first baby, that little one was in the NICU, and she was a good sleeper until she came home. And so even though I had a bit of a delay before my baby came home, it still was an adjustment for me. And then we have to think about feeding schedules and advice, and sometimes unwanted advice. The doctor visits, they want you to have your baby in within the time they're 5 days old in the state of Florida. It's not a law, but it's a strong suggestion. And then you follow up so many times after that. Your body changes. You still have responsibility to take care of. And then sometimes parents learn new things about their partner through a new lens of parenthood, for better or for worse. So there's just so much going on all at once. And it's no wonder that sometimes new moms tend to neglect themselves. All right. So let's get to the purpose of this talk. The point was to focus on breastfeeding and nutrition, and I wanted to focus on some key nutrients for this fourth trimester. Okay, so we can't talk about that fourth trimester without talking about this trend of snapping back and losing weight. Unfortunately, when you're restricting calories, eating less for the purpose of losing weight, doing that too soon and too fast can actually cause malnourishment. So sometimes initiating that diet restriction so soon after birth can actually exacerbate adverse postpartum symptoms. And believe it or not, it takes a minimum of 6 months and as much as 18 months to fully recover from pregnancy. So this picture may be true for a lot of people, but I'm so glad this narrative is changing. But this is just not realistic for everybody, and it's really not necessary. The key is to nourish yourself and take care of your body as it heals. If you think about it, the uterus gets to about the size of a dinner plate, and then that uterus is birthed. And the inside of that uterus, the placenta is birthed. The placenta gets to the size of a dinner plate. So the placenta is birthed, and it has to detach from the inside of the uterus. So that's how big of the detachment, and that part has to heal. It's a bit of a wound, and that part has to heal. So it's really important that we prioritize nourishing the body so that we can heal and begin to start moving and doing some exercise when it's appropriate. So I like this term called postpartum depletion. There's a gentleman who came up with this term. He wrote a book, but the point is he talks about postpartum syndrome of accumulated issues, including deep fatigue. A lot of people can relate to that, or that's one of the number one things their clients are talking about. Hypervigilance, when you feel like you can't rest. I'm sure you've had a lot of your doula clients or your lactation clients saying that I just can't rest, or some of you are therapists and you hear that. So that hypervigilance, and just a feeling of being overwhelmed. So a lot of these do stem from physiological issues, hormone changes, sleep disruption or sleep deprivation, and then you have the psychological, the mental, and the emotional factors. We call it mom brain, or actual maternal brain shrinkage. And that's because, and then you're pairing that with the nutritional demands of breastfeeding, which are very high. So we know that a lot of these symptoms are associated with being nutrient deficient. And a lot of this stuff can be addressed easily just with some nutrition intervention, especially if you have that intervention immediately after pregnancy. We term it as basically postpartum malnutrition. And so a lot of research does draw a line between specific nutrient deficiencies even and postpartum depression. So what are some of the nutritional requirements for lactation? So for our nursing folks, they need on average 300 to 500 additional calories on top of what you usually eat. That's assuming you're already eating enough to meet minimum needs. So eating 3 meals a day, 1 to 3 snacks a day, whatever your body is demanding. So, and again, just another 300, that may be just a really healthy sandwich or something like that. It doesn't mean like two breakfast plates or, 2 dinner plates. If you're nursing multiples, it can be up to an additional 1,000 calories. And I do have some moms who exclusively breastfeed twins and triplets. So their nutritional needs are quite high. If you're pump dependent or you're a preemie mom of a preemie nursing or pumping, that goes for you too, because we know that pumping is breastfeeding. So for each nursing and pumping session, it's estimated that 100 calories each time is burned. So if you're thinking about a mom who's pump dependent, she's pumping 7 or 8 times in a 24-hour period, that's going to be 700 to 800 calories she's just burning doing that. And a lot of babies can nurse 8 to 15 times a day, especially when they go through that first growth spurt and they really start to figure out that, oh, this is where the milk is. Let me come at it many times. So that's you're talking about up to 1,500 calories that you're burning a day. So moms like that may need to be consuming close to 3,000 calories a day. It just really depends. To maintain your milk supply, to really push prolactin, you want to make sure you're moving milk at least 8 times in a 24-hour period. And that's going to help maintain your supply. That's going to help, as your baby has growth spurts, you can meet that need with nursing by moving milk. And then for some people, they do need to take a daily multivitamin. Prenatal vitamins may or may not be appropriate. That's something you want to talk to your doctor or midwife about to see which is going to be best. So again, the number of calories you need is going to vary from person to person. A lot of my clients who want nutrition advice, they say, well, how many calories am I supposed to do? And that number is just going to be so different. About half of my clients like to track their calories. That's not overall necessary, but that's something we can do. I don't recommend that for new moms. That's one more thing they need to do. But the key is just to focus on what are you eating on a regular basis, every day, every meal, every snack. What are you choosing? So the number one thing is always going to be increased fruits and vegetables. If this was a lecture about, improving, nutrition during cancer, increasing fruits and vegetables. If we're talking about heart disease, increasing fruits and vegetables. So that there's a pattern for a reason. And that's just because fruits and vegetables carry the most powerful nutrients that our body really needs. We also want to decrease the amount of added sugars, added sodium, and fat in the diet. So that's going to be just limiting and avoiding processed food as best you can. And then, especially in the Black community, we see a lot of iron deficiency in our community. So we want to make sure we're being very intentional about eating food that has a lot of iron, protein-rich foods, calcium-rich foods, vitamin D, potassium, folic acid, and then also nutrients like fiber. I think over half Americans don't even get the minimum amount of fiber that we have. And working in the hospital, we have so many people who are sick, but then they're also like constipated and they have other things going on with their bowel. So just putting them on a regimen to increase fruits and vegetables that are a good source of fiber can, help them with their bowel health as well. And then there's other nutrients like choline and iodine. And we're not going to go into details about those last two, but those are very important. And if anyone wants any information on that, feel free to reach out. So let's jump into iron. The two pictures that you see here are actually two smears of blood under the microscope. And if you look at the top one, obviously the red blood cells are lighter. They don't have as much of that red pigment. That red pigment is called hemoglobin. And the protein attached to it, the heme, is what carries the iron. So obviously, if there's not enough of that hemoglobin inside the red blood cell, that's going to be an iron deficient red blood cell. And if you look at the smear on the bottom, those red blood cells are darker. They have more of a round shape. So they have more iron. They're, have more hemoglobin because of the iron. So, and this is very important because just because you have a baby, there's going to be blood loss. And the issue is when you're pregnant or even before you conceive, it's important to have adequate iron source because we expect everyone to lose blood. It doesn't matter if you have a vaginal delivery or a C-section, you're going to have some. If you start out high, you have some wiggle room for the blood loss. But if you start out very anemic and then you lose blood, then that puts you at a higher risk of needing a blood transfusion, which of course we always want to avoid. What we know about iron deficiency anemia is that the more iron deficient you are without addressing it, you're more likely to be fatigued. You're already tired because of just by having the baby, but that's going to make it worse. We know that folks who are iron deficient for long periods of time, they think differently. Their cognition, their response time is a little sluggish. And we do know that it's also associated with depressive symptoms. So if you're already experiencing some depression and you're iron deficient because of the nutrition part, that's going to even have a negative impact on how you interact with your baby. If you're overly tired, you're sleeping more. Maybe you don't respond to your baby as much. And then you layer on top of that, you may have some postpartum depressive symptoms going on. So it just kind of exacerbates an already bad situation. What we also know is that when a mother is not responding to her baby frequently, what we see is some people may say, wow, that's a really quiet and cool and calm baby. That's such a good baby. But the reality is your baby will give up and they no longer expect this mother or this person is going to respond to their cries. So the cries no longer work. So then you have a negative impact on how the baby responds and navigates in this world. And there's a lot of really good research on babies who are kind of ignored, not picked up. You actually see differences in their brain structures and stuff like that. It's really, really good. There was a professor out of the University of South Florida who presented that. And that is more of neglect and things like that. But just even with the nutrition, there is some research to support how nutrition is associated with baby behavior and mom's behavior and depression. So I just wanted to kind of draw that line. Long-term, anemia, iron deficiency can affect the reproductive cycle, especially if conception of the next baby occurs within within a year and a half or 18 months. And that's why they say, hey, as best you can, let's space these pregnancies out to allow your body to recover. The reality is sometimes we do see moms who are only 6 weeks, out of their pregnancy and they've already conceived again before their blood levels have picked up and things like that. So that puts that next pregnancy at risk. And so that's a lot of the stuff that we dealt with at WIC, and I'll talk about that a little bit later. So where do we get iron in our body? So iron deficiency anemia is actually one of the most common nutrient deficiencies worldwide, but majority of the types of iron deficiency anemia is easily fixed with better nutrition. So if you're a meat eater, consuming foods such as protein foods. If you like liver, my mom had us trying to eat liver when I was growing up, and I didn't really like it. But if you like beef, chicken, turkey, if you like seafood, you'll find some iron there. For plant sources, there are a lot of plant sources with iron. So I love the fact that you have more people who are vegetarian nowadays, are vegan, but they can get iron from their foods. The caveat to that is that it's not as well absorbed from vegetables and plant sources as it is from meats. So one way you can do is, if you're eating what we call a non-heme source of iron from plants and vegetables, just consume something with vitamin C at that meal, like, some kind of fruit, or you can drink a little vitamin C rich juice or something like that. So that's just something to think about. But there's plenty of iron out there, and a lot of it is people just don't like to eat a lot of certain vegetables, and then like with food insecurity. So for my doulas and for my lactation consultants, anyone who is in the birth working space, it's definitely important to make sure, and again, I'll talk about that later, that your patient or your client is meeting their nutritional needs. Because if you're trying to help her with breastfeeding and postpartum recovery, you're going to run into a wall, because she has some other things going on that we need to address. All right, moving on to zinc. Zinc deficiency is definitely associated with postpartum depression. We know that it's important to have enough zinc stores during your pregnancy. Some people may need to do a supplement if they're not able to eat enough after pregnancy, but having enough is associated with a lower risk of PPD. It is also a very important component of breast milk. It actually helps to support the baby's growth, cognitive development, and immune function. We know that when people are sick, and they're starting, like, even if you have a cold that you can't knock, or like a virus that's dragging out, we tend to notice that one of the things, part of the nutrition therapy, and I'm happy for this, is we definitely supplement with multivitamins so that folks can get zinc. We also supplement with zinc and vitamin C for like wounds. We deal with a lot of like bed sores and pressure injuries with my patients in the hospital. So zinc is definitely something that helps to aid with wound healing. So think about it. You have that bit of a wound that's inside of the uterus from where the placenta detached, but you also have, again, my moms have the C-section surgical wounds, or you may have a vaginal tear. So having enough zinc will aid in that as well. So that's how nutrition plays an additional role with the postpartum recovery. We also know that it helps to regulate menstrual cycles, and some of this stuff I can't see because of how my screen is. And then it helps with ovarian follicular cycle to promote ovulation. So your next pregnancy is at a better, it's going to be in better shape. And then, of course, plant sources of zinc is going to be like your plant sources, of course, meat, fish, seafood, and eggs. So there's a little bit of a pattern here. You have beans, nuts, whole grains for my vegetarians. Some vegetarians, depending on the type of foods they eat, you may need to get a supplement. Zinc is not very available in certain foods. It's not well absorbed from a lot of the plants, but still it's really important to make sure, even if you're an omnivore like myself, I always tell my omnivores, you still should be eating half of your diet, at a minimum half of your diet should be plant-based. All right, so moving on to protein. So protein is one of the most important and powerful nutrients in the human diet. So protein, it gives you what we call amino acids, which is kind of like the building blocks of a lot of cells, wound healing, tissue. We know it for our hair and our skin and our nails, and it helps to maintain muscle. It helps with repair of tears, exercise recovery. Protein is just very important in the human body and the human diet. So for lactating folks, they need slightly more protein during that lactation stage. It takes more protein to make milk. So of course you're going to need more. For those who are moving a lot, when you're clear for exercise, you want to make sure you're still consuming enough protein. We know in the grand scheme of things, for people who are trying to have a healthier lifestyle or even trying to lose weight, once you're cleared by your doctor, we know that protein has a more satisfying, how can I say it? It's more satisfying, so you don't have as much craving and hunger when you're consuming protein. So I actually tell my clients to try to do protein as a snack. With protein, you should aim for 4 to 5 servings a day. I'm not anti-keto, but for new moms who just had a baby, breastfeeding moms, I don't recommend keto or very, very low carb diets, or which also have a lot of fat. It's important to talk to your doctor about what's appropriate for you, because your health could be affected by these diets. For example, a lot of new moms develop kidney disease, actual heart disease. So a keto diet that's super high in protein and fat, but very, very low in carbs is very inappropriate. So that's why we need to have these postpartum visits and, reassessments after you have a baby. And of course, you should see a dietitian. So protein food sources, it's going to be protein-rich foods that have high amounts of iron and zinc. A lot of our protein-rich foods have calcium. So, but that should also include plant-based options. So I talked about meat, meat, fish, and eggs. Beans and rice actually is very unique, and it makes a complete protein. So for people who absolutely eat no meat, no fish, if you eat a good variety of different types of beans with rice, especially like wild rice varieties, which have more fiber, brown rice varieties, anything that's like minimally processed, you're going to get a complete, like a full complement of amino acids that has the same complement of amino acids that you find in meat. Of course, for my omnivores, my meat eaters, you want to choose lean cuts of meat. Meat tends to naturally have a lot of fat. So, the same old adage, trimming the fat where you can. You want to always choose baked over grilled and fried. And of course, the air fryer is just fine. All right, so moving over to calcium. So calcium is definitely a really important nutrient. I know when I was growing up, they were always like, you should, drink milk to get calcium. It's important for your bones. It works with vitamin D, but it's also important for fetal bone growth. If you don't have enough calcium during your pregnancy, what the body does, and it's a bit of a survival mechanism. It's pretty neat, but it's not good for mom, but it basically will break down the calcium in your bones during pregnancy, and some in your teeth, to meet the baby's needs, because the baby is prioritized when it comes to certain critical points of development, and it can take away from the mother. So the way it's been described for years, this is something that people in birth space have known for years, but that's basically what's happening. If you have enough calcium consumption during pregnancy and after pregnancy, you're going to move into what we call more of a bone recovery stage. So everyone experiences a little bit of bone loss, but again, if you start out good and you have a little bit of that loss to support the pregnancy, you're not going to drop too low until you have a very high risk of bone breaks and poor bone health. But if you start out low, of course, the risk is going to be higher for bone breaks or losing your teeth. So, and then of course, we all move into menopausal age, where we actually have like a big drop in bone growth. Like we're always kind of building bone and breaking down bone to get calcium how we need it. It's a very small percentage, but that building stage actually kind of diminishes the closer we get to our postmenopausal years. And then that will increase your risk of osteoporosis. So to prevent that, it's important to prioritize calcium when you're thinking about an overall healthy diet. So, and then of course, pregnant and lactating folks should consume at least 1,000 milligrams of calcium every day. So I wanted to address teeth sensitivity as well. And I mentioned that calcium and vitamin D, they both work together for bone and teeth health. It is very true that a lot of women experience loose teeth during pregnancy. Tooth decay in pregnancy is more likely due to already underlying teeth problems. A lot of people say, before I got pregnant, my teeth were fine. And then after I had, during my pregnancy or after I had my baby, my tooth fell out or it just cracked or something like that. But they may have already had some underlying teeth problems. So dental hygiene is very important. Other things to think about is, sugary beverage intake during pregnancy. A lot of women will drink a lot of ginger ale. And so that can put you at a higher risk of, tooth decay or dental caries. Sometimes we're snacking on more sweet foods during our pregnancy because our body's kind of craving that. But again, you have to fall back on your dental hygiene because that can be deleterious to your teeth. And then actually frequent vomiting during pregnancy can wear down the teeth. The phosphoric acid from sodas can wear down the teeth as well. So good nutrition during pregnancy is important. For some people, after they have their baby, especially if you have really bad nausea and vomiting, you may still have some nausea and some vomiting after you have the baby for a few weeks up to a month, I've seen. So it's important to be intentional about getting enough calcium during that time. And I just wanted to take a moment, Amina. I don't know if there was anything that came up in the chat related to those last few slides.
Nothing that I'm noticing on my end, but I
Okay.
definitely feel really lucky to be listening and taking these in. I have my notebook, I have my pen and my paper,
Okay.
right? Because, like I said, I'm a doula, and these things come up in my work with my clients, and I'm so happy to be getting firsthand insight from you as an expert in this area. So I'm
Awesome.
tuned in. I hope
Awesome.
everyone else is.
Thank you so much. Okay.
But
So
for
just
everyone else, if there are any questions that you have, please, I encourage you to ask them in the chat, and I can get them over to Dykibra for you.
okay. All right, so thank you. So moving on to vitamin D in the fourth trimester. So vitamin D is also a very powerful nutrient. I remember when we first started talking about vitamin D, 15, maybe 16 years ago, about how it's so important because, most people were deficient. And that's because now we know that it's not only associated with bone health, it's actually a hormone, an endocrine regulator. It's actually associated with immunity and gut health. And then, of course, the calcium and bone metabolism. So one thing we know is that the vitamin D content of human milk is associated with mom's vitamin D levels. So we recommend that if you're exclusively breastfeeding, that baby be given at least 400 international units of vitamin D3 within a few days of birth, or the lactating person themselves can take a minimum of 6,400 international units of D3 to meet baby's her vitamin D requirements and the baby's vitamin D requirements. And I bring that up because some people are really uncomfortable with giving their baby any kind of, supplement or dose. They don't want them to have anything other than breast milk, which is, I think that's a good thing. So it's important that if that's your choice, to make sure that you yourself are consuming enough vitamin D to make sure your baby doesn't become deficient. There have been some studies, again, this is us talking about how nutrition is associated with postpartum depression and anxiety. There are more depressive symptoms seen in those who have very, very low blood levels of vitamin D. So I recommend when you're getting like your follow-up check, and at least once or twice during your pregnancy, to have like your baseline vitamin D levels checked to see how much, if any, vitamin D supplementation is necessary. We know that long-term vitamin D deficiency is actually associated with chronic disease risk, as well as osteoporosis osteoporosis in postmenopausal women. So, and vitamin D is pretty easy to find. It's pretty easy to supplement. And even if you get a prescription, just depending on your insurance, it can be as little as like $5 a month. So I know I pay $7 a month for mine. But it could be very low. And then for some people, the over the counter is just fine. You just want to ask your doctor, get some recommendations, or just ask your doctor how much you need to purchase from an over the counter. And I've seen it as low as like $5 or $6. Where can we find vitamin D? We can find it fortified in if you drink dairy, consume dairy, cow's milk. A lot of the milk alternatives, like your oat milk, your soy milk, or your almond milk, these are fortified with calcium and vitamin D. So it may not be a natural source in its unprocessed state, but they've been adding it to these beverages, which is a good thing because a lot of people they enjoy these beverages. They make shakes from them. They may add it to other types of drink or teas or coffee. So adding that calcium and vitamin D is a really good way to get it. We can find it in okra, soybeans, and tofu. The tofu has to be fortified, so check the label. I know white beans are a good source of calcium. Fish and sardines have vitamin D. Orange juice, if you're an orange juice drinker, it's not a natural source of vitamin D and calcium, but what those companies have been doing for at least a decade now is adding calcium and vitamin D. So just again, make sure you're reading your label and it specifically says it has calcium and vitamin D. And then a lot of the breakfast cereals, cod liver oil. I remember when I was growing up, my mother, I'm an 80s baby, so my mother would give us a tablespoon, not even a teaspoon. We had to do a tablespoon of cod liver oil every day. And you know what they always say, everything old is new again. So now you can get it your fish oil pill, but all it is the cod liver oil that our moms gave us when we were growing up. So it's very important. So thank you, Mom, for making me do that until I was 15 and I put my foot down. But they kind of knew what they were doing back in the day. So let's talk about folic acid. And folic acid, I'm sure you guys have heard this for a long time if you've been working in birth spaces. We know that folic acid is important for pregnancies. It's important for brain function, mental and emotional health. It's important for the production of DNA and RNA, especially, and this is very specific, what we call rapidly growing and developing cells. So that is fetal development, because remember, with fetal development, you go from 2 cells to, trillion something celled organism to make a baby. So those are rapidly dividing cells, and having enough folic acid make sure that development pretty much goes flawlessly. And it's important for growth periods. So the teenage years is very important. Lactation is very important. We know it the most for the prevention of neurotube defects in future pregnancies. So again, here's that pattern. We recommend to at least delay the next pregnancy, not getting pregnant and you have a baby literally 18 months after your first. We're saying wait to conceive at least 18 months. There is a difference. So wait to conceive at least 18 months so that you can get the best nutrition status you can for your next pregnancy, okay? So breast milk has what we call folate, which is a form of folic acid, and this supports the growing infant's brain growth. And nursing moms should consume at least 500 micrograms. For everyone who is of childbearing age, we say a minimum of 400, but for nursing moms, it's a little bit more. Obviously, if you're nursing multiples, it's a little bit more. If you're carrying multiples, it's going to be a little bit more. So we don't have to supplement our babies with folic acid. They get enough if they're getting enough breast milk. Just a little word on drinking alcohol. Actually, if you're drinking alcohol, especially in excess, it actually prevents our body from utilizing the folic acid, which leads to a specific type of anemia. What's the most important thing to take home from this, especially for my doulas and my birth workers, I try to tell my mothers to be very intentional about your future pregnancies and birth spacing. Half of pregnancies, 50% of pregnancies are unplanned. But it doesn't mean that 50% are unwanted, okay? But an unintended close pregnancy can put the next baby at risk of folic acid deficiency and put them, if they have a folic acid deficiency, that's going to affect that baby's development. So when we're talking about getting back to our, going out again, finding me again, getting back to myself, and that social drinking, I always tell my moms, do not drink in excess. Make sure that if you're with your intimate partner, if it is not your intention to conceive soon, use whatever protection. Even my married folks, I said, look, go ahead and use a condom if you're not ready for any kind of hormonal contraception. But intentionality with having children is important because, and I can do a whole lecture on intentionality, but being intentional about spacing that baby is to make sure that that next baby is born in the best nutritional condition. So it's just something to think about. All right, so where can we find folic acid in the diet? So it's going to be majority fruits and vegetables. And I'm sorry, I'm in my kitchen, so we're, working on some things here. I'm in my dining room, so I apologize. But the best sources are going to be your fruits and vegetables, and then dark green leafy vegetables especially. And this is really important because my family, they're from South Carolina, but they're descended from the Gullah Geechee community. So the foods that we eat a lot of dark green leafy vegetables in our diet. We eat a lot of beans and legumes. We don't eat a lot of white rice. We eat more like brown rices, red rices, wild rices, because of their nutritional component. But these are foods that, we kind of grew up eating. So again, our parents kind of knew what they were doing, and we were already getting those foods. So if you prepare those in a healthy way, you don't have to walk away from those traditional food ways. So our dark green leafy vegetables, if you're a citrus eater, we have plenty of that down here in Florida. So our oranges, we're moving into strawberry season. In Florida, the strawberry season is actually the winter months. So strawberries, if you like liver, nuts, the beans and peas, lentils, poultry food, whole grains. And in 1998, believe it or not, the United States actually started fortifying flour with folic acid. And they actually saw a huge decrease in the occurrence of neural tube defects as a result. So we know, and then we also know that women who are childbearing age, we recommend them take a multivitamin with folic acid. So folic acid is a very important and powerful nutrient. All right. So there's a really good question. Are there vitamins and supplements that help with fertility issues? Thank you for that question. I'm not an herbalist. That would be a good question for an herbalist. But there are some herbs and supplements that are good, but that's kind of out of my scope. But let me make sure I get your information so I can put you in touch with a good herbalist. But they're doing a lot of education with lactation consultants. I don't know with doulas, if they have training, but I'm seeing a lot more formal training with herbs and supplements related to fertility, with some good results. So, but that'll be definitely a question for like someone who's more versed in like herbs and things like that. All right. So let's talk about another, everyone says drink water, but water is actually one of the key nutrients. When they ask dietitian, what are the 6 nutrients? Water is on that list. So it's important to stay hydrated. Number one, to, make sure we have a good blood volume. Of course, it helps to reduce the instance of constipation, dehydration, overheating, and overall just balancing water and fluid losses during pregnancy, lactation, and just with our everyday lives. Fluid intake is definitely important for kidney health, joint health, and even blood pressure regulation. Working in the hospital, when I'm not doing peds, sometimes I cover like our heart floor, people with chronic diseases, specifically like heart disease. And that's one of the biggest things that we see that they're not consuming enough of. And then when I work with my very elderly patients, they're not drinking enough. And we see that a lot with our pregnant and lactating moms. And so when you're dehydrated, you actually do have some, like clinically dehydrated, you see some just some cognition changes, some forgetfulness, a little bit of agitation. That's the worst type of dehydration, but it can occur. And what we could see with PPD is some of that low level clinical dehydration where, moms are a little bit more agitated. Again, we talk about them, being a little bit hyper vigilant. And we found that when people have some mentation changes and we run their labs, they actually are quite dehydrated. And even though we see this a lot more in the elderly, I don't see why this would not translate for a new and nursing parent. So for lactating folks, we want you to consume an additional 300 mils. So that's like another 10 ounces on top of the 64 ounces that we're recommending for everybody. Okay. And that's because you lose a lot of fluid. I know with lactation, we do what we call these before and after weights. And sometimes we have babies drink 5 ounces, from the breast. So what's 5 times, that's 150 milliliters in one session. So, that frequent, regularly nursing baby, or if you're pumping a lot, you need to replace that fluid with water. And of course, if you're thirsty, we recommend, hydrating with something with water other than like sodas and juice and things like that. And again, a low level is 48 ounces for some people because you're just smaller and you may not need as much fluid, but really for the general population, a minimum of 64 ounces a day. And again, another 10 ounces on top of that.
So Dykibra, there's a couple questions in the chat, and we're running out of some time.
Okay.
I just wanted to make sure that we got to the chat before time was lost. Lori asks, well, she says, I have moms who lose their medical coverage and don't return to their doctors after birth. Can you give a general supplement recommendation? Any prenatal vitamins, or switch to postpartum, or just a multivitamin, iron, omega-3, choline? Any recommendations?
Minimum multivitamin. Doesn't necessarily have to be a prenatal vitamin unless you know that you're iron deficient, you have a history of iron deficiency. A multivitamin with iron should suffice.
And a follow-up question, what would you recommend to moms saying that they are too nauseated to take their prenatal vitamins?
If they're too nauseated, try to eat small amounts of food, like, healthy foods, fruits and vegetables, rather than eating like large meals, to help curb that nausea. I know some people say ginger tea can be helpful. But if you're experiencing like severe nausea to where you can't keep anything down, you're definitely going to have to get to the doctor sooner than later, even if you have to go to the ER. It could be an emergency.
Okay.
Okay.
Mm-hmm.
Let me jump through a few slides, and I just want to get to the end. So we talked about these, foods to eat. I always tell people to do easy snacks, yogurt, granola, do sandwiches if you have to meal prep a little bit. Honorable mention is going to be a good old PB&J. Hard-boiled eggs on toast make a really good snack. You can never go wrong with a handful of fruit, popcorn, pre-made salads. Just with gestational diabetes, if you have that, definitely get to the doctor much sooner than later, and only do your exercise once you're cleared from your doctor. If you have blood pressure problems, if you have to take medication, definitely do a follow-up appointment as soon as you can rather than waiting, so that you can see if you still need to be on this medication or get like another month's worth of a prescription to keep taking the blood pressure medication. Make sure you rally support to improve your nutrition goals. You know, if someone says, what do you need? Say, hey, I need you to get my protein shakes because I like it. I need you to, come by the house. Make sure when you're getting help, you're actually prioritizing your nutrition. For your clients that are lacking resources, please, 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 direct them to programs like SNAP, like WIC. Food insecurity can exacerbate your patients' nutrient deficiencies and their breastfeeding difficulties. It's going to make your postpartum recovery, it's going to make it harder for them. So direct them to programs like WIC. There's also free lactation support if you can get in with WIC. We have something called Healthy Start in the state of Florida. They may have other programs like home visiting programs in your state. So again, Healthy Start, WIC, they actually do employ lactation professionals that can help you, and it's free. It's a very underutilized resource. Also March of Dimes, if you have moms who have preemies, there's programs. We have the Early Learning Coalition in Florida, early steps that helps moms who, have preemies. How do I help them with therapy? If you don't know what's going on with your new baby who has things going on, you can't focus on your nutrition. So tie them into those programs in your state. Melanin Mothers Meet is a mother support group. She talked about it in my bio. There may be programs in your area. It's going to be different from state to state. I really, really, really want to talk about NAMI. If you don't know, NAMI is the National Alliance on Mental Health. That is a mental illness is a national organization. So we have a local group in Tallahassee. Postpartum Support International is a really important group. And again, doula support, they can tie you into the right person. But these are just local stuff that we have here, but I just wanted to put it in your mind. Does my patient have food? Does my client have food? Does she have the things she needs? Is she getting that support? Do I see signs of PPD? I need her to make an appointment with her doctor. I need her to make her appointment with this grief counseling. Some of my doulas are grief doulas. So making sure you know that where to send them for resources. And just remember, the fourth trimester is a huge transitional time. This is me and my daughter. She's 10 now, but that's us, month 5 of 7 total in the NICU. So I had a very long fourth trimester. But she did good. We tied in. So almost all those resources that I showed you on the other screen, she did breastfeed for 3.5 years, but with a lot of support, like lactation support, speech language pathologist, and she did really good. So, but that's my little one. And then make sure you enjoy your baby. When you're struggling, think about that beautiful baby you made. But if you're having a hard time, tie your patient, your client into those resources. This is my second one. She's 6 now. That's her pretending to be, falling asleep. But these babies play possum, and that was probably the best time. They would keep me up all night, and I said, okay, you want to keep me up? Let's take pictures, let's do videos. And sure enough, she wasn't asleep. So she wakes right on up. So that's the end. I'm so sorry I took you guys over time, but I hope this was very helpful.
Thank you so much, Dykibra. And your babies are so adorable.
Thank you. They're big girls now.
I know. Don't you remember when they were that small?
I do. I
Thank you
absolutely do.
so much. I've learned so much, and I can't wait to get this info back to my folks. I took notes and I intend to do even more research. Thank you all out there for joining today's webinar. And I hope that the insights and resources that Dykibra shared today was able to empower you on your journey, empower you to take care of the mamas that you're working with. Remember, breastfeeding is a unique experience for every mother and child, and the support you need is always within reach. If you have any further questions or need additional resources, please don't hesitate to reach out to Birthing the Magic Collaborative. Continue nurturing yourselves and your little ones with love and care, and have a good evening. Bye.
Thank you, everyone.